So in this video, we're going to talk about the back. First, we have spinal stenosis. With stenosis, your pain will increase when you extend your back, and your pain will decrease when you flex your back. So when you're leaning forward, for example, and that's why it's called a shopping cart sign. Or when you're walking uphill, like you're also bending forward a little bit, that'll make someone's spinal stenosis feel better. You diagnose stenosis by doing an MRI. Next, we have disc herniation. With this, you're going to have pain worse with lumbar flexion. With herniation, you're going to have brief, like shooting pain when you're bending forward, straining, coughing, things like that. And they'll feel better when they lay down. Disc herniation also has a positive straight leg test. Next, we have lumbosacral strain. So this is a muscular strain. It's not an issue with the spine. So they have paraspinal tenderness. This usually happens after like they've really exerted themselves and they'll not want to move because it hurts. But the treatment for a strain is actually physical therapy and just NSAIDS. If you have back pain at night that's waking you up, that's quite concerning, especially if you're older and you have a history of cancer. You should definitely be concerned for metastasis to the spine, and to diagnose that, you want to do an x-ray. Now, let's say the patient has a fever, they're having this back pain, they might have history of drug use, then you could suspect possibly an epidural abscess, and to find that, you want to do an MRI. If you have back pain and you also have like numbness or lost feeling in your legs, and you also have incontinence, those are really big red flag signs concerning for spinal cord compression or quada equina. So for this, you have to emergently do an MRI because they might have to go to surgery. And because you're concerned for spinal cord compression, you would give the patient steroids and then send them immediately to get an MRI. Vertebral compression fracture. So this is very common in older people, especially if they have like osteoporosis or history of osteomalacia. This will have point tenderness. So at a specific point when you're pressing or palpating their spine, it'll hurt. So next we'll talk about some curvatures of the spine. First, we'll start off with scoliosis. So when you go to your pediatrician's office, they would always have you bend over and touch your toes so they can see if your spine is straight or not. If it starts to curve, they definitely keep an eye on it, because your scoliosis is more at risk for progressing during growth spurts of puberty. Once you reach Tanner stage 5, puberty is concluded and the risk of your scoliosis progressing is quite minimal. There's 2 measurements you should look out for. One is spinal rotation and one is a Cobb angle. If your spinal rotation is more than 7 degrees, then you should evaluate further with an x-ray. If the Cobb angle is less than 10, that's fine. If it's more than 40, you should refer for surgery. Next, we'll talk about kyphosis. So this is when you are like hunched back, which is very common with working at the computers or studying a lot. This is easily correctable either by like laying down or extending your back. If it doesn't self-correct, and if the curvature angle is more than 60 degrees, then you should refer the patient for surgery or refer them to get a back brace. Next is lordosis. So this is kind of the opposite of kyphosis. Lordosis is when you have an inward curvature of the spine, and it's very common in pregnant women. So we have spondylolisthesis, and this is an anterior slippage of the vertebral body. This happens more commonly in like the lower lumbar region, and you'll have pain during extension. Lastly, we'll talk about ankylosing spondylitis. These patients will present with back pain and morning stiffness that'll get better with exercise or with moving around. They have a reduced range of forward flexion of their lumbar spine, and they also have reduced chest expansion, so they can kind of present with like a restrictive lung disease presentation as well. To diagnose this, you have to take an x-ray of the sacroiliac joint, and you can also monitor disease progression by taking x-rays of this joint as well. Everyone with ankylosing spondylitis will be positive for HLA-B27, but everyone who has HLA-B27 won't necessarily develop ankylosing spondylitis. Some other manifestations of this disease are anterior uveitis, aortic regurg, inflammatory bowel disease, and enthesitis when you have tenderness at the tendon insertion sites.